Historically, when you are sick and need to go in to receive care, you automatically assume that you need to be seen by a medical doctor or physician. However, with the mass shortage of providers, especially primary care providers across the country, a new type of provider has begun to take hold, the nurse practitioner. Hello, my name is Caitlin Sarda, and today I will be educating you on the role of the nurse practitioner. Let's start with the basics. What exactly is a nurse practitioner? The American Association of Nurse Practitioners describes an NP as a clinician that blends clinical expertise in diagnosing and treating health conditions with an added emphasis on disease prevention and health management. Nurse practitioners bring a comprehensive perspective and personal touch to healthcare. All NPs must complete a master's or doctoral degree program, and they also must have advanced clinical training that prepares the NP to practice in primary care, acute care, long-term care, as well as many other settings. In some states, NPs are able to practice independently without the supervision of a physician. In others, their scope of practice is a bit more limited and physicians must sign off on some of their orders, such as prescriptions. However, their role is still very vital and valuable to a healthcare system. There are a few key points that I want you to take away from this presentation. NPs can practice autonomously and in collaboration with other healthcare professionals to provide a full range of primary, acute, and specialty healthcare services. Some of these services include ordering, performing and interpreting diagnostic tests, diagnosing and treating both acute and chronic conditions, prescribing medications and other treatments, managing and counseling patients in their overall care, and educating patients on disease prevention and positive lifestyle choices. There have been multiple studies that have been conducted proving that the outcomes of patients that are cared for by an NP are no poorer than outcomes cared for by a medical doctor, proving that there is no added health outcome benefit to seeing a medical doctor or physician. The AANP states that NPs can lower the cost of healthcare for patients. One example is that patients who see an NP as their primary care provider often have fewer emergency room visits, shorter hospital stays, and lower medication costs. Another benefit, especially in rural areas like here in South Dakota, is that NPs are able to provide services in rural areas where care was not previously available. The role of the nurse practitioner has been around since the 1980s, but is still a new concept to many in the public. NPs are quickly becoming the healthcare provider of choice for many Americans due to the many reasons that we have covered in this presentation. I hope that next time you are in the market for healthcare that you consider choosing a nurse practitioner as a partner in your care.